Again, welcome back. This is our fourth hour. So today I do have a couple questions before we get into the detail of my presentation. So first, to both of you, why do you think I'm talking about language today? Do you guys have any idea?
I think like the nature of our job is really communicating with people. So when it comes to communication, the way you deliver a piece of information is quite important. It really, it really will govern how the way that the recipient will receive it. If you are talking about in like for say you're talking something really confidently, people will tend to believe it. You're
Hmm.
talking about something like you're unsure about you're talking like uncertainly, the patient will doubt your maybe professionalism, those things. So language itself, and I would say like non-language, I'm not saying that part. Yeah, so language itself, I think it play a key role when we
Hmm.
are delivering things to our patient. Yeah.
Yeah. So Thomas, you're talking more about the communication aspect of language.
Mhm.
That's sort of what I'm trying to say, I guess. Is that correct?
Yeah,
Is
yeah,
that what? Yeah.
that's
Okay.
correct.
And Kia, why do you think I'm talking about language?
Um, I think um, I'd like to touch on a couple different things. First thing is when we're explaining things to patients or educating patients, we have to sort of choose our words carefully and
Mhm.
and use the correct language. Um, One thing, or not just language, even like your tone, things like that, body language. We have a pro bono clinic at school where we have we volunteer there every week, and we have a program called Move More for stroke patients, and stroke patients come and to get rehab and treatment, things like that, and a few of my classmates would talk to them like baby talk and things like that, sort of like they had cognitive deficiencies. And, like these are people, they're not like, they don't have cognitive deficiencies. You don't need to talk to them that way. And, and it's just choosing your language and just body language, spoken language carefully. And another thing is, we all use a certain language in our personal life, and we need to understand that as clinicians we need to have a switch where when we're in a professional environment we put on our professional language, and when we're in our personal life we can use our um, not be so kind of restrictive with our language per se.
Right. So I guess the 2 points you're saying is that first, we need to sort of tailor the language to the patient, and we shouldn't like coddle the patient, even if they have some sort of deficiency or they don't. We cannot assume. We'll have to try to speak to them in a respectful, in a manner that's fits them. And then the second part we were saying is that sometimes some of us could be a bit of a potty mouth, let's say in our personal lives, F this, F that, but even though we don't mean anything like harmful, but then when we're talking to patients, we could, if we say that, it could be, well, first of all, not professional, but secondly, it's just, yeah, it could potentially harm somebody.
Yeah,
Is that
definitely.
what Okay, alrighty. So next couple questions, they're I guess more so rhetorical, but I want to just run through them. Second question is, have you worked with anybody who spoke a different language? Now I'm talking more so about, like whether you speak Farsi or Chinese or Italian, Spanish. So this also a type of language, even though, I think I'm still talking about what you guys kind of touched upon. That's sort of my main topic. And then next is, have you told the patient to perform rehab exercises and they didn't do it? Again, this is like touches on how we say some things. Sometimes, even if we mean to say something that's beneficial to patient, they might not take it as well for whatever reason. And next, have you been asked to repeat yourself? Again, when we're communicating, a lot of times, even though we try to communicate clearly, we still may have to repeat whether or not we're not enunciating our words or we're just not being clear with our message. And then the last thing is, how many times have you heard misconceptions or myths from people, whether it's misinformation that's spread online or whether or not patients say, my previous chiropractor, a doctor told me I have a weak core, I have XYZ, and that's the cause of my pain. So these things, I'm sure, well, I've experienced a lot of these many times over the last 8 to 9 years of my practice. So have you guys experienced any of these at all over the last, I don't know, couple years?
Yeah, definitely, really a lot.
Yeah. So I guess this comes down to my main message is that here's a definition of language. It's a system of spoken or written communication used by a particular country, people, community. Typically consists of words used with a regular grammatical and syntactic structure. Also, it's a formal system of communication by gesture, so things like sign language. So these are all just ways for us to communicate with another person. So language is essentially a way for effective communication. So a couple questions for you guys. Again, why do you think we need to communicate effectively?
Because I think it's basically the nature of our job. So because we are helping our patient to like get rid of their problem. So we first have to know the problem, and then we kind of need to know what's the root cause, which is like giving some sort of diagnosis. And then afterwards, one big part of our treatments will be actually be done by our patient, which are maybe exercises. So first, because there are a lot of like exercises, there are a lot of people who know how to do it. Even patients know how to do it, with like the help of YouTube. But why? But we need to give them like a reasons to do it. So I think communication is just the basics of our job duties. We have to be really good at it effectively in order to like not go to the wrong ways or misunderstand something. So we give wrong the diagnosis or wrong treatment. Yeah.
Mm-hmm. And Kia, do you have anything to add to this question? Why do we need to communicate effectively?
Yeah, just to optimize patient care and just so that we don't leave anything vague and leave any room for interpretation by the patient. We let them know exactly what we think and what we want from them, so that everything is clear.
Yeah, I think a lot of times is that we need to communicate effectively so that we could be efficient, right? So we're not spending a lot of time explaining things, or not spending a lot of time just trying to get the patient to understand what we're doing. We just try to get to the point, however possible. It could differ from one individual, one patient to the next, and there are different ways to communicate as well. Again, here are a few other questions for you guys, but well, more so rhetorical. So what do we need to do before communicating? I think from my standpoint, there are a couple things. First, who's the audience? You have to understand the patient. So you guys have touched upon that, whether it's a patient with a post-stroke where they may have difficulty understanding things, or somebody who's elderly, or is it a child that we're speaking to, or somebody who's our peer. Like if I'm treating a physio or a physician or a chiro, the language you use may be different. And next, what are we trying to convey? Now, a lot of times, it happens to me a lot, is that I'm mumbling and talking in circles and not getting to the point. And that comes with practice as well. So really, we want to try to find the key points where we want to communicate and try to get to that point so that we can communicate effectively. And lastly, what questions do we need to ask? Because in order for us to communicate or teach somebody or provide some education to somebody, we need to know what they know first, and we need to know where they're coming from so we can tailor our communication, our language toward their level of understanding. So now, what can we do in order to communicate effectively? And these are some of the things that I've listed earlier that I thought were really important for us to adopt or use to be able to communicate properly. So first, motivational interview. Have you guys heard of this concept or this strategy at all?
Yes, because my girlfriend is a occupational therapist. So in their practice, when they are treating those like psychiatric disease, patient with psychiatric disease, they kind of tends to use these kind of interview, or what they call is those CBT, cognitive
Cognitive.
behavioral therapy. It's like
Yeah.
it should be the similar thing in my view. Yeah.
Yeah, and I will elaborate on this point a little bit and in my next slide. So next is a common strategy we may be able to use. By doing action, we achieve benefit within time. So Thomas, by doing these rehab exercises, we can get your body stronger within the next 3 weeks. So you are going to be able to minimize your low back pain. Or Thomas, by eating this type of food, we're going to help to improve your, let's say, blood markers for diabetes within the next 3 months, so that you no longer have to worry about, if you're eating a little bit more sugar. The next strategy is open stack. So first, you use an open-ended question to get the patient talking, and next is a strategic move toward a resolution. So that question could be a little bit more geared or targeted. And then lastly is a closed yes or no question. So it could be, hey, Kia, what do you know about isometric contraction for hypertrophy? And then the next question could be, hey, Kia, do you know that it actually works? Or it could be, what about if I tell you a little bit more about isometric contraction for hypertrophy? And then so that I'm setting the tone, I'm setting the stage for me to talk a little bit more. And then lastly, we can say, hey, Kia, what are your, do you think this is, a good conversation we just had? And Kia could say yes or no. Actively listening, rephrasing what you heard. This is so important. I can't stress that enough. I remember when I was a younger chiropractor, I did not used to do this as well. And a lot of times I'm just trying to say what I wanted to say. But in fact, you need to ask the right questions, and then you listen, and not just hearing them, but you're actually understanding what they're trying to say. And oftentimes I like to repeat what the patient said almost in the exact same words, or at least paraphrase what they had said, so that they know that I understood what they said. So that will help to make them feel like they've been heard as well. And oftentimes, analogies can be used in clinical setting as well, especially when a patient who's you see that they're not quite sure what you're talking about, and you need to somehow relate another scenario to what they know, that they know, so that could be used to understand the current topic. For example, a lot of time we talk about, this is not the best analogy. I'm just using an example, but a lot of times, patients are better after the treatment. And tell them, hey, maybe it's good for you to come in, once every couple months, just for some maintenance checkup, so that we can make sure you're on track with your rehab. And you can say, look, we bring our car back for maintenance tune-up from time to time, and that is, regardless our car has any issues or not, may be a good option for us. Again, this is another topic for maintenance. In the literature, there is mixed messages or mixed evidence about maintenance care. So I'm just using that as an example. Or let's say somebody has pain, and I use an angry person analogy. If you're in pain, it's kind of like a person who's angry. How can you calm them down? You can't just tell them, hey, calm down. You can't calm them down immediately. So you just have to give them some time, give them some space, maybe give some tender loving care, like offering them some water would be equivalent of offering them some heat or ice or whatever it is. And given enough time, they're going to calm down. And then you come back and address it. So after some time, the pain is better, then you come back and start to introduce some rehab. And next anecdotes. I think a lot of time I like to use my own personal experience, whether it is my own pain experience or my other patient experience, so that we could tell the patient, look, you're not in this alone. I've experienced it. My other patient have experienced this, and there's a way to get out of this situation. So that helps to elicit some sort of emotional response as well, and gives people a lot of hope. So I'm not sure if you guys know, I did have a chronic low back pain from about 10 years ago. It was likely a irritated nerve, your typical lumbar radiculopathy presentation, radiation down the leg, numbness, tingling. I actually had a little bit atrophy in my glute and calf, I think. But anyhow, it took me about a year or so. So I did tell my patients, like, look, this could take some time. When I was 25, supposedly healthy, active, it still took me that long. So if this is taking you about 3 months, 6 months, don't worry. This is still just part of the process. So these things give people at least a peace of mind. And lastly, philosophy. Again, sometimes you could get a little bit philosophical, so that patient can understand the concept a little bit bigger. You can kind of step back and look at the bigger picture. I won't elaborate too much on this point. So next, what I wanted to do is to talk about motivational interview specifically. I'm not going to elaborate on the other points, but this is what I really want to stress. The motivational interview is a counseling method that involves enhancing a patient's motivation to change by means of 4 guiding principles represented by the acronym RULE. So first, resist the writing reflex. 2, understand the patient's own motivations. 3, listen with empathy. And 4, empower the patient. Now, a lot of times when we're talking to patient, if they said something that isn't necessarily correct or something that we don't agree with, we always have a bit of a tendency to say, hey, no, that's incorrect. Listen, let me tell you the right thing. I've definitely done that plenty of times in the past. I still do that from time to time. However, we do need to understand why we do that, if it is actually the right time. So I would recommend to just withhold your judgment, withhold your writing reflex. Just listen and try to understand a little bit from their perspective. Perhaps once they understand, you realize that, okay, that's why they learned what they learned, and that's why they believe what they believe. And of course, listen with empathy. You cannot judge as a clinician. We have to, again, try to put ourselves in their shoes. If I were in their situation, if they were my mother, if they were my brother, if they were my best friend, how would I help them? And lastly, empower the patient. You want to show patients that they have control, right? It's not just about you fixing them. It's not just about you giving them whatever that you want to give them to help them. It's more so that they have the control, they have the power, they have the ability. You're just here to try to support them and enhance their own ability to get through their issues and injuries. So now I wanted to go over this video together. It's about 6 minutes, and I wanted your thoughts on this video. Are you guys ready for this? Do you guys need a break at all?
No,
Go
we're
ahead.
good.
Okay, all right, here we go. Can you guys hear?
Yeah.
I don't think it's the
Hopefully,
case that people are either not motivated or motivated. And in fact, motivational interviewing was born from conversations with very, very difficult people who were classified as not at all motivated to change and very resistant to treatment. Well, Mr. Smith, that's your medication sorted out.
Good.
Blood pressure's a little on the high side.
Yeah.
Okay. I wonder if I could raise the subject of your weight.
What?
I wondered if we could spend just a couple of minutes talking about your weight.
You are joking, aren't you? I mean, look, I've made time in my day to come here.
Yeah.
I'm kept in your waiting room for 45 minutes.
Yeah.
It's not acceptable. You know,
Yeah.
if I make an appointment with
Yeah.
a client for 10, I expect them to start at 10, not quarter to 11.
Right, and so you're busy enough. And
Yeah, I've got other things to do. I've got
Yeah.
accounts to do. I've got clients to coming in.
Yeah.
You know.
Yeah. And it wasn't necessarily easy for you to make the time to come down, and you had to wait in the waiting room. And now I raise the subject of weight.
Yeah,
just
I mean,
when you're
okay,
thinking
fair
of going.
enough. I've got to have my blood pressure
Yeah.
medication changed, but I
Yeah.
really haven't got time to talk about my weight. I mean, you know, I'm aware of my weight, I'm aware of the problems, and I'm also aware of the solutions.
Right.
So I don't really need a discussion. It's just I've got too much to do at the moment, you know.
Right, and so it's been a bit of a rush for you coming in.
Yeah.
And I'm sorry about the wait in the waiting
Well,
room.
it's bad form, you know.
Yeah, yeah, that's not easy for you, because you'd like to go really soon, and here I am asking you to spend just a couple of minutes with me.
Yeah, but basically I've got things to do. I've got to get back to the office. I've got a pile of work that I've got to deal with.
Yep.
And every moment out of my day means I have to work in the evening or weekends.
It counts.
Well, when you're self-employed, you haven't got a choice, you know?
Exactly, exactly. It's up to you. Just a couple of minutes.
Well, I'm here now, so yeah, okay, if it's a couple of minutes, yeah?
I promise.
Okay, because I really must get on.
I want to simply ask you how you feel about it.
About what? What, losing weight? Well, obviously, I want to.
Yeah.
Yeah, I mean, who doesn't? I mean, I'm aware that I'm over my balance weight, but I know that it's causing problems. I mean, obviously, I get out of breath if I have to do something a bit hurry, and I realise that I'm on this blood pressure.
Right.
And maybe that's probably contributing to it.
Right. So you can see the links between your weight and your health, and you'd like things to be.
Yeah,
a
I
bit
mean,
better.
there are other things, but I mean, yeah, the weight is something I would like to get hold of, get the handle on. Yeah.
You'd like to if you could.
Yeah, I mean, I know the theories of a bit of exercise on a regular basis, a balanced diet, but unfortunately, because of my lifestyle, because of being self-employed as an accountant, it's finding the time to exercise, but also finding the time to sort of think, okay, I'm going to go shopping for this, that, and the other, and I'm going to prepare a meal.
Yeah.
With me, it's very often
Ready meals and that sort of thing.
yeah, food on the run, you know,
Okay, yeah.
grazing.
Let me see if I can summarize what you've said, and then we'll see what next. You lead a busy life.
Yeah.
You run a business, and you've got a lot to do.
Yeah.
Yeah. You're aware of the links between your health and your weight, and you are concerned to some extent about that. And ideally, it sounds like you'd like to do something about it. It's just that your life is busy and rushed, and you tend to use convenience foods in order to get the work done.
Yeah, I mean, to a certain extent, because of my lifestyle, food is just fuel.
Yeah, yeah.
You know, because I'm juggling all these balls and I don't want to drop any.
I get it, I get it. And so if you could fit it in, you would like things to be different, but that's not so easy.
No.
Okay. Can I suggest that you come back and see me in a couple of weeks' time just to chat about this?
Okay, I'm up for that, but it's going to be the same problem of A, finding time,
Right.
and B, if I make an appointment,
Right.
I don't expect to be kept waiting for half an hour or
Exactly.
whatever, because it's...
Exactly. I'll tell you what might be a nice solution is if you come down first appointment, and I give you an appointment at 8:30.
That'd be good.
Then there'll be absolutely no waiting. And the purpose of that visit will be to have a look at how you really feel about how you could move forward and somehow fit in a more healthier lifestyle into the busy work life that you've got.
I'll maybe have a look at my schedules, see whether
Yeah.
anything can be arranged, or I can pass something
Yeah.
on to some, and so that so
if
it's not a wasted interview. So I can come here and say, okay, I've looked at my schedules, I've looked at things,
Good.
whatever.
Good. And see if you can fix it up and also give some thought to what we've talked about.
Yeah, of course.
Good stuff. Okay.
Okay, thanks.
Okay, all the
Sorry I went
best
off a
then.
bit.
A few well-chosen words, a very thoughtful question, can be worth more than many mouthfuls of busy talk.
Well, I I want to try to stop smoking.
That's quite a decision.
Well, it is because I've been smoking all my life.
Okay, I think that's probably just a little bit marketing for their course now. So, let me exit from that. So, what did you guys think? First of all, Kia, do you have anything you want to share? Just some general thoughts.
Yeah, I thought he was very empathetic with the patient, and rather than just, trying to get whatever he wanted to say out of the way and just get the patient out of there as soon as possible to see the next patient, he sat down and kind of tried to diffuse the situation, kind of instead of just handing out like a diet and saying, "Oh, go follow this," he was like, let me see what works for you within your schedule so that you can follow it, because if you can't follow it, then there's no point. It's like for us as physio, we give a home exercise program to a patient, and if it's so lengthy or for some reason the patient can't follow it, it's not going to be effective. So we have to just find a way to give them things that they could do that fits their schedule and they can actually do it and improve.
It's valuing valuing the patient's goals and expectations and fitting into their lifestyle. Yeah. And Thomas, do you have one or two things you want to add to what you thought of that?
Yeah, I kind of like the way the practitioner actually like sum up everything the patient said, because maybe some of the time the patient knows the problem is there, but they kind of do not think about it in a like a more systematic way, or do not like haven't been talked to anyone about this problem. And I also like the way he kind of moved forward to the next session. So the next session, he like kind of bring up the idea of asking the patient like think about that, and then see how his schedule really is, and see whether they may squeeze some time in the schedule to have something works for that patient. So it's kind of I also like the way he is kind of planning the next session, the objective for next session to tackle the patient's problem.
Yeah, so he's a pretty good problem solver, trying to figure out what the issue this time is, and then how to move on the next time so that this same situation doesn't have to happen again. So that's great. And I thought that this whole interview, who was doing most of the talking? I think it was probably the patient, right? The clinician only just kind of asked questions, rephrased a few things, maybe at the end summarize a little bit more. Bullet points, essentially just systematically, like you said, to bring the issues to the point. But yeah, I think a lot of times when we're treating patients, even the patients coming in to see us, it's not about us, of what we do at all, even though that's what we're taught in school. We do this, we do that, we do this, and we explain to the patient a lot, sometimes overly, about what we do. But really, it's about the patient, understanding their goals, their expectations, their barriers, so that we can hopefully help them to break down those barriers, help them to be productive and effectively trying to get to their goal. So moving on, the common mistakes that I find a lot of time in communication, and again, these are things that probably has happened to me before, so I've kind of listed them. So again, sometimes we don't even realize that we have these mistakes or blind spots. So a couple things I want to highlight are things like civic language, fear-mongering messages, or mixed messages that confuse the patient, or just misinformation or misinterpretation of the information. Again, I've probably, as a chiropractor, used these in the past, not because I intentionally wanted to. It's more so because, well, part of it could be my education. There's always this alignment thing that we talk about, the posture thing, even though now we know based on research is completely bogus. There's no perfect posture. There's no perfect alignment. Your spine doesn't get out of alignment. So these are things we try to avoid as much as we can. And of course, the more we learn, the better it is that we are informed, so we don't hopefully unintentionally or intentionally make these mistakes. And also, the other thing I often notice is that when we talk to people, or not just patients, we often say, oh yeah, I agree, but versus if you said, I agree, and how does that sound differently? I think when we talk about I agree, but oftentimes whatever you said I agree with, you completely dismiss that. That completely is irrelevant. Versus you say I agree, and that means okay, you're telling the patient that I understood what you're saying. I do agree, and then there's other things that we could do to improve on that. So I think these are the things that we really need to pay attention. And I had no clue about this. Even now, when I talk, I often catch myself doing that. So that's something I want you guys to even try talking or the strategies to use to in order to have a better communication with whether it's your friends or your patients. And now overcorrecting patients, we did kind of talk about that. Sometimes we do need to address some of their misinterpretations. However, we can't overly do that. Every time they say something you don't agree with, you can't just say, "Oh no, you're wrong." That's just disrespectful, first of all. Also, it just shows that you're not really trying to help them. And paternalism, being dogmatic, again, a lot of times, there is an imbalance between us as the clinician versus the patient in terms of power, because we're in a position of power, even though it shouldn't be the case, even though we have the knowledge, have the understanding, but we do not know the patient's body and their experiences better than they do. So we shouldn't be talking over a patient. We shouldn't be like, hey, you need to follow me. These are the things you have to do. And obviously, being dogmatics, we without thinking about or logically, rationally, coming from an empathetic point of view, just following a system aimlessly because that's what we've been taught. Again, the next thing is being overly simplistic without explaining the details and nuances. You could give simple explanation to things. However, sometimes that simplification may overlook the process. Let's say if a patient asks you if an exercise is good or bad, a lot of times we just try to answer the question, yes, it's good. No, it's not good. However, somewhere we know there's no bad or good exercise in general. It's just that if the exercise doesn't suit their need, then that could potentially be a bad one for the time being. However, we have to be able to explain that to the patient rather than just say, oh yeah, that's a good exercise, it's a bad one. And next point, being dismissive. A lot of times, we say things like, oh yeah, you're fine, even though we're not being necessarily being dismissive, but you could come off as that. So again, it comes down to the previous point, is that we do need to be able to explain our thoughts and nuances without being overly complicated at the same time in this more simplistic way, so that they don't feel like you're dismissing them and overlooking their issues. And lastly, making assumptions. First of all, we have to make some assumptions, otherwise we'll be asking so many questions. We just can't be efficient or productive. At the same time, we cannot make assumptions in a lot of situations because we tend to overlook things, and then we stop being empathetic. We stop trying to be understanding, and that assumption. We all know what the saying is: when you make an assumption, you make a whatever out of you and me. So yeah. Any questions about these points, guys?
No.
So next, I'm going to give you guys a patient case. This is a specific case. I've seen this patient a number of times now for over a course of about 2 months, 3 months or so. So this is Jenny. She's a female patient in her late 50s. There is a language barrier. She speaks another language. However, her English is actually not bad. And I feel like I could understand her pretty well. And I think she does understand me to a certain extent. Her primary complaints are low back pain and bilateral knee pain. She does have a history. He does have obesity, hyperlipidemia, and hypothyroidism, and some of those conditions are being managed by medications. So she had been away from exercise for a while due to COVID, and once I spoke to her, once I told her, encouraged her to exercise, she went back to doing 2 to 3 hours of gym, that includes a combination of treadmill, elliptical, cycling, swimming, and some machines. Not all in one session. However, a lot of times there were multiple of those different types of exercises within one session. She oftentimes says, when I ask her how she's doing, she says, "I'm better, but I have pain." Or if I'm asking her, "Are you feeling any different?" She says, "It's the same. It is still painful." And she would pretty much repeat those same messages on every single visit, which to me was challenging. And there are numerous times where she called herself fat or lazy. When I asked her how she's doing with her diet, how she's doing with her exercise, she would say things like, "Oh, yeah, I'm just lazy. That's why I'm not doing my exercise." Or, "Look at me, I'm just fat." Despite the fact that she is going to the gym regularly. There are multiple times where she mentioned to me that acupuncture has helped her, and because she has had acupuncture by another practitioner in the past, and she often asks me if it helps, even though I've explained to her my answer whether or not it would help her. And again, there are multiple sessions where she asked me, "How many sessions do you think I need to make the pain go away? Is it 10? Is it 5?" And I try to give her some answers without giving her a specific number. I think one time I did say, "Okay, let's try 10 visits and see what happens." And then, that's sort of how I see fit in that situation. So my diagnosis for her, again, these are a little bit long, but I'm trying to incorporate the whole picture. First, the diagnosis of her back pain is aging-related low back pain with signs of degenerative disc disease, sacroiliitis, diffuse idiopathic skeletal hyperostosis, which is also known as DISH. And she did actually bring in multiple ultrasound, X-ray, MRI from various years to support this diagnosis. And then the second diagnosis is bilateral knee OA with limited ability. And then in terms of my DDS or differential diagnoses, inflammatory arthritis, including rheumatoid arthritis, seronegative spondyloarthropathy, which are things like ankylosing spondylitis, could be potential differentials, also along with fibromyalgia and chronic pain syndrome. Now, the management I had, the plan of management that I came up with her include obviously patient education, reassurance. We talked about pain, exercise, nutrition, weight management, and a few different other topics. Rehab exercises are some of the things that I work on with her almost every visit, maybe not the first 2 visits. However, we have gone over quite a few exercises together. And of course, manual therapy, part of the treatment includes soft tissue therapy, joint mobilization, spinal manipulation. And these are things that she actually really likes. And acupuncture, I've tried it two times, once with electrical stimulation, once without. And again, this is at her request because she did say that acupuncture really helped her. So I did not want to dismiss her beliefs because again, if it helped her, why would I not try it on her? Especially when I make sure that there's no contraindications for her. So I guess. Oh, by the way, do you guys know what DISH is? Diffuse idiopathic skeletal hyperostosis?
Not really.
No,
Not really.
okay. Yeah, this is commonly seen in, it's a finding. It could be a diagnosis. It's more of a radiographic finding where there's bony spurs projections from each part of the vertebrae to the ones above and below. So there's multiple segments that are actually fused because of these bone spurs or bone. Yeah, so again, this is idiopathic because we actually don't know the cause of it. It could be genetic. It could be due to aging. Don't quote me on this. I could be wrong. I need to check my sources. I think we do find this in ankylosing spondylitis quite a bit. Again, don't quote me on this. I could be spreading misinformation. So let's go check on my sources later. But yeah, so this is one of those conditions where if you cannot diagnose this without an X-ray or some sort of imaging, which she has. Yeah. Which could explain some of the stiffness that she has in her spine. And challenges. Now, these are the challenges I thought I had with this specific patient. First, there is a language barrier. She's not super proficient with English, even though she understands most of the things I say. And again, English is, I'm not a native English speaker as well. So my communication skills could be limited. It's funny how, English is not my first language, and I'm not an expert in talking about communication because I don't find myself as a super efficient, effective communicator, and yet I'm talking about languages presentation. So it's kind of ironic. And now I do find that she is quite pain focused. Every time I work on some area, a sensitive area, she always tells me, "Oh, it's pain." And I do tell her, "Oh, I understand. This could be why. This could be why." And multiple times she said, "It's pain." And I asked her, is that a question, or is there something you want me to do? Do you want me to go easier or lighter? And she's just telling me, I just want to tell you. And then it happens a lot of times. So I find that a little bit challenging. I'm sure you guys can relate as well when somebody's so pain focused, associate pain with damage. And that is really hard to progress. And now the self-talk, self-image, calling herself fat or lazy, again, that's something that we may have to dig a little bit deeper why she says that. Perhaps it's due to previous experiences by other people calling her that, maybe some sort of trauma from earlier on in her life. In addition, she does seek more binary or absolute answers. She asks me, is this helpful or is this not? However, I explained the nuance. She just ask me, is this good or bad? A different way of asking just a binary answer or absolute answers. Jason, how many visits I need? 10. And she tries to make me come up with a number, which I did come up with a number, but then I still explained the nuances why I thought that would be a number. So again, it's these situations, even though they're not trying to intentionally put you on the spot, but you do feel like sometimes you almost have to give in a little bit so that you can move on to be productive and be efficient. Or all or nothing. So this is where I did tell her it's okay to go to the gym. And I explained to her that listen to her body and I told her try to again be systematic so that you're not overdoing things, also not doing it enough. And then she has that mentality of, okay, Jason told me to go to the gym, I'm gonna do it almost everything. And I'm going to do everything to the fullest extent. So she's literally at the gym for 2 to 3 hours. For somebody who hasn't gone to the gym for a while, I think that might be a little much. And then the last point is that, is it her health conditions that I find challenging to manage? Or is it more so the communication, the concept, the ideas that I find challenging? And to me, I think the health conditions, of course, there are things outside my scope of practice to manage. However, these conditions, they are in a way complex and complicated. In a way, we could be very productive in terms of addressing them. However, I think it is the communication aspect that I find the most challenging. And that's where things like motivational interview, that's why trying to understand the patient's culture and just understand their previous history would be very important for me to be able to come up with a better strategy to communicate with her. And now I kind of put in a general resource that's by the Ontario Chiropractic Association regarding communication strategies for chiropractors, but not just chiropractors, but also physios or clinicians. So there are some specific strategies that I will not go over in detail because I'm not too familiar with a lot of them. However, quite a few of them, like the analogy, we'll kind of talk about. So yes, that's the end of my presentation. I want to go over another sort of Instagram video. I wanted to get your thoughts. However, for the moment being, do you guys have any questions?
Not much right now. Yeah.
Okay, alrighty. Any feedback from me, by the way, so far?
I think it's all good. Yeah. Particularly, we kind of have a case that we kind of see how we should incorporate and actually see those things in our life as a VCO, like back in my days in Hong Kong, because when the peoples come to public hospital for physios, they are often like kind of lower income side, so they are not really well off in their life. And then I kind of encounter a lot of patients sharing similar characteristic at yours that presents it there. So it's kind of also bring me the ways I interact with those patients back in those days. Whether I have like a better ways to motivate them to help them to get a solution for their health problem. So yeah, that's really good.
Yeah. And Kia, do you have any thoughts, or is there anything you think I could have done better for this patient?
No current thoughts at the moment.
Okay, all right, sounds good. I wanted to share this post. Somebody sent it to me on Instagram, and they thought it would be good for me to look at it, and then I had some thoughts. They didn't really want my feedback, so I wanted to go over this with you guys. Give me 1 second. Let me just find this. So yeah, just hold on. And Thomas. So check your Instagram right now, and it's a short reel on Instagram. Take a look. What do you guys think?
What is the proper posture to reduce the amount of strain on your back? Well, if you stand, you have to pay attention to the body. If you feel that you have pressure going forward on your toes or back on your heels, you're obviously not in the proper posture. But even if you're equally distributing the weight on the soles of your feet, you have to do so by aligning your shoulders, the hips, and your feet. One point, like this. Now, it's trickier when you're walking, but try to do it even as you're walking. It's a bit clear. So think of this. Get a good posture.
Guys are both finished?
Yeah.
Yeah. Oh, by the way, we're going a little bit over time. Are you guys okay with just?
Yeah, it's fine.
Yeah. Yeah, you're good?
Yeah.
Okay, sounds good. And then also, if you look at the sort of the description, the captions, there's 7 points of what they said. First of all, like, just not talking about the content, how do you guys think of him being a communicator, presenter? Like, was he like, how did he sound?
I think particular like standing, walking posture, everyone is different, right?
Yeah, I'm talking
Yeah.
more so just like how he carried himself, not so about not the content.
Ah,
Yeah,
Yeah,
the way he spoke.
I feel like he was very articulate, very concise, very confident, and
yeah.
the way he was speaking, it sounded like he kind of knew what he was talking about.
Yeah.
Mm-hmm.
Yeah, like he's so smooth, right? He does not stutter. There's no like versus me, I stutter all the time. I make mistake, I correct myself, and I have trouble finding the right word at moments. So to him, to a general public, this person is like, wow, he's a neurosurgeon, talks so well, uses his body language, uses hands, gestures. He's a good communicator. I would trust him. Yeah. So
Mm-hmm.
now let's get to the content. Yeah, Thomas is kind of talking about posture. There's no proper posture. And Kia, what are your thoughts on the content?
Well, the first thing we learn about posture in class is that there's like a spectrum of what is normal, and it just depends on the patient. So there's no normal, and we're trying to stay away from calling it normal posture. So that was my first thought when I heard what he said.
Yeah, and then also yeah, exactly. And he did not explain that in this post at all whatsoever, right? He's talking about, okay, you need to keep your spine aligned, you need to keep your shoulder back. If you lean forward, that's means something. If you lean a little bit backward, that means something. I think, would you guys say that those are not true?
I would say he do not address the various posture, because not everyone walk the same way. Like my grandmother, she often say that he is walking like toe outward, but he's walking like that for her entire life, and she doesn't have knee pain. So is that the correct posture for me? Maybe
Yeah.
not. Yeah. So
Absolutely.
everyone is different. So it's just putting all the things too simple. And
Yeah.
kind of sometimes if you put things too simple like this, you kind of create some misconception to the ones who are receiving your information, which is not educated in this aspect.
Yeah, exactly. Especially for those patients that are wondering what's the best posture. And now they're like, oh, I'm supposed to be like this. And then sometimes they could be so hung up on that ideal posture that they worry so much, oh, I'm not supposed to sit like this. I'm supposed to sit like this. First of all, we can't for extended period of time. Anyways, we're just default back to our normal posture, whatever that is, right? So this content to me, I think is very no civic, right? Even though they were trying to help, they don't mean harm, but then it's pretty inert advice, but then actually maybe perpetuate ideas that could potentially cause harm. And again, sure, somebody could benefit from this, I'm sure. However, this is not for everybody, especially for somebody who has a good following, has lots of likes, lots of shares. There's like 2,000 shares. I think this is so easy for this type of information to spread. And look at us, we're spending like so much time just talking about this. It takes so long to demystify, debunk, or correct the misinformation, right? And then even when you read, do you guys mind if I explain a little my thoughts further?
It's fine.
Thank you. Okay. Yeah, just looking at some of these points, the first one, keep your shoulder back and relax. If I'm keeping my shoulder back like this, I'm no longer relaxed. So like, where's the logic, right? It's like a little confusing, almost mixed message. Sit or stand up straight with your back aligned. Again, what's aligned? What's aligned? Is this not aligned? Is this not aligned? Again, there's no optimal definition, or because there isn't, right? So we're trying to fix something that never needed to be fixed. So yeah. And then the next point, avoid slouching or hunched over. Again, it depends, right? I slouch all the time. I'm sure you guys do hunched over. However, we don't spend so much time in that. It's the time that we spent in that static position that's potentially triggering our discomfort, not so much the way we look. So again, same goes back to the previous points. There's no ideal posture. There's a spectrum of what we call normal posture. And then number 4, use ergonomic furniture, equipment to support your spine. I mean, that could be a useful idea, especially if somebody has a job that really requires them to sit for 2 long period of time. It's better than not having a little bit of support, I guess, possibly. Number 5, take regular breaks to stretch and move around. Sure, that's something that we tell patients all the time, so I would agree with that. Exercise regularly to strengthen your core muscles. Again, this is one of the things I feel like is very nocide because it puts emphasis on the core muscles. We don't exercise to just strengthen overall, but we have to strengthen our core. And why are we putting so much focus on the core? So that, again, for a lot of people, oh, I have back pain, I have this pain. Oh, I need to strengthen my core to make it better. No, there are plenty of people that have strong core and still have back pain. So core strength is actually not an issue. especially once we understand the literature. And then the last, practice good posture habits in all daily activities. Again, this kind of goes back to what he was saying. When you're walking, you're supposed to walk this way, that way. Yeah, actually, I'm not gonna explain that more. It just, yeah. Overall, I thought this content is like, not to be mean, it's pretty like not useful and pretty like garbage. Sorry. Yeah. What are you guys' thoughts of what I just said and my breakdown?
Mostly I agree with you, and it's scary how much of that information is on Instagram or social media at the moment, and it's not only does it not have any benefits, as you said, but it could potentially be harmful or fear mongering or make people anxious, and yeah.
Mhm.
Yeah, and I think things like this. Well, like, so I guess when we see
Dr. Jason, your voice cut off.
battery, can you hear me now? Okay.
Yeah.
So what are the things that we could do, or should we do anything about things like this? Any thoughts on this?
It's really hard to, because it's the amount of exposure for, say, these kind of like misconception, false information, like getting 50% in the media, and then another 50% is correct one, and then it's really hard to get the correct exposure if the patient like do not have the knowledge for that. But I think it's important when we hear this kind of like misconception, we first give it. I personally I want to give it like let the patient know what I agree on first. For say that post we got 7 point, and we kind of agreed on 1 to 2 point, and then I will then give the rationales that I kind of don't agree on, and then it kind of give more educated option for the patient to trust one one thing over the other, because maybe for a lot of patient the posturing part is kind of they kind of think, oh, they need to be up straight is the best. But I often say when I telling to do some poking chin like scap set exercise, I'll just tell them I'm telling these because it's not because it's the best posture, because it's because you usually may not be engaged in this posture. You kind of always slouch forward, so that I let you have another options to like be in. So it is not necessarily the best posture to be in, but it's a good posture to let your neck muscle take a break from those like head forwards posture. So
Right, it's an option rather than it has to be that way.
yes. So for say in the posture part, this thing it is the way that I convey my message to the patient. So I think my way of telling the patient like this is kind of still addressing their own belief, thinking, oh, upright posture is a good posture to be in. But I also tell them that they are not the only posture that you should be in. So
Right.
so this is like an example that I kind of let the patient to accept a new idea, which is actually maybe a more correct idea.
Okay. All right. Sounds good. Yeah. A lot of times we reinforce the positives and then like don't crap on the negative things too
Yeah,
much, because if it goes against their belief, then like they feel bad about themselves, or they will think that, oh, you feel like they think that you feel you're superior to them, which could knock on your own credibility, potential integrity as well. Yeah. Okay. I think, yeah, that's probably all I wanted to talk about. Is there anything else you guys want to talk about before we conclude for today?
No.
Okay. Well, thank you both for your time. And I'll probably cut this a little bit and then put it on YouTube if you guys are okay with me making this public.
All right.
Okay.
Yeah.
And then we'll probably do something a month from now, and hopefully somebody else can present something. If Thomas or Kia, if you wanted to, and I'll ask in the group as well if somebody wanted to present something. And then we'll go from there.
Sure.
Alrighty. Well, good to see you both, and have a great rest of the day.
Yeah.
You as
Good.
well. Thank you.
Thank you. Yeah. Thank you, Jason.
Have a good night.
Yeah, take care.
You too.